Alright, for case A, it sounds like the patient may have a de Quervain stenosing tenosynovitis, which is basically just an inflammation of the tendons that connect the forearm to the thumb, right around there on the radial side of the wrist, especially where they go underneath the extensor retinaculum. Manual techniques that would be appropriate for this patient include early on in the early stages of inflammation, passive and active range of motion, light active range of motion, just to avoid tissue adhesions or muscle atrophy. Mobilizations of any of the joints around the thumb and wrist would be indicated, especially if they decrease the patient's symptoms and allow him to move in a pain-free range. And then as the symptoms subside, we could start with more aggressive strengthening, mobilization, and and then so exercises to prescribe would be rubber band exercises that put the thumb into extension and abduction. Any sort of wrist strengthening exercise, perhaps using band exercises or holding a can while keeping the wrist neutral and doing reps into the ulnar and radial planes of motion. Therapeutic devices that might be recommended for the patient would be, depending on how active the patient's going to be. If he's not going to be very active, we could do something as simple as just a mulligan technique where you bias the tissue to one side or the other. If it's going to alleviate his symptoms, or if he's going to be more active, if he has to use the wrist a little more actively, such as like at his job, we could do like a brace or a splint to prevent him from putting his thumb into abduction extension or any sort of range that's going to further irritate his stenosing tenosynovitis. Also, we could do like a thumb spica splint if he's not going to be very active, just to protect the tissues around the just to protect those tendons around the wrist there.